Hello, I'm Dr. Joseph Cerna, and I'm a physician practicing in Santa Ana, California. For the past 25 years, I've seen increasing numbers of people with brain, muscle, and nerve swelling from Epstein-Barr, and this is being called chronic fatigue fibromyalgia, the restless leg. The ongoing symptoms, the chronic ongoing symptoms, have to do quite a bit with the normal bacteria that's circulating in the blood that shouldn't be there. There's a septic state, you might say. But the importance of this clip is that with increasing numbers of people with this virus and their long-lasting symptoms, I've seen quite a few folks with ALZHEIMERS and also with post-traumatic stress disorder whose symptoms are aggravated because they have this brain, muscle, and nerve swelling. Because they have this brain, muscle, and nerve swelling that hasn't been diagnosed. So a typical patient would show up and is complaining of neck, back, and leg pain. Usually the left side of the body, left side of the neck, pectoral, deltoids, and upper extremity, left upper extremity, and left lower extremity are achier than the right. For some reason, there's a predilection for the right side, the left side, I mean. It also goes to the brain. There's an encephalitis, which causes anxiety and depression, and strange dreams, and inability to sleep, concentrate, and the foggy mindedness. Along with this, it has predilection for certain nerves, like the nerves that go to the pupils, and there's problems with constriction, so there's blurred vision and difficulty in focusing. It seems to go to the vagus nerve, which causes the vagus nerve goes down to the stomach, and it seems that there's problems with the emptying of the acid. You have reflux, so the acid builds up, but it doesn't empty, and at nighttime you have this reflux. There's also a slowing down in quite a few of these patients of the heart and palpitations, and of course lightheadedness, and people have been known to pass out and lose consciousness because of these decreased cardiac outputs. Also, there's constipation, and it seems to affect the pudendal nerve and the erections males suffer, along with bladder emptying. The restless leg thing seems to be a neuritis, and the sensation of legs feeling like tight socks and burning the feet that keep the patients up at night is very disturbing. Women have the problem with the bacteremia and the immunodepression, where bacteria makes its way to the uterus, and there's low back pain, pain on intercourse, dark menstrual periods, and it's so many times described in chronic fatigue articles that it might be possibilities of it being something hormonal, which it's not. It's bacteria. It's PID, or gram-negative bacteria, most likely. And of course, all these patients know that they work out, drink alcohol. If they work out, drink alcohol, and exert themselves, they'll feel much more tired. There's more bacteria after exerting themselves in the blood. So these patients with post-traumatic stress disorder and Alzheimer's have the foggy mindedness, and the bacteria cannot make its way to the brain, but there's a blood-brain barrier, but bacteria makes excretia, and that can reach the brain, and that irritates certain parts of the brain, and the anxiety and depression flares up, and the symptoms are aggravated. Okay, what to do? So the beauty of all this is the simplicity. The beauty of all this is the simplicity. You give them a good rather decent antibiotic. Augmentin is a very good antibiotic. It covers gram-positive and gram-negatives. Normal bacteria we're trying to cover. And as I tell the patients, the antibiotic is to kill this bacteria in order to convince oneself, because there are no exams, that one is debilitated. And 99% of the times, the patients will notice a big difference. And I've seen quite a few people with anxiety, depression, and dementia improve. That's why I'm recording this clip. So, Augmentin, say 500 milligrams 3 times a day for an adult, and usually within one day or two they'll feel much more improved. The pain goes away, the anxiety goes away, but it'll recur. So, thanks to that great Dr. Linus Pauling, two-time Nobel Prize-winning doctor who tried 10,000 milligrams of vitamin C on patients with cancer, which didn't work. I wish he knew that for this type of problem, it works like a charm. It's extremely works very, very well. It is, I tell every patient, it is a magic number. The adults do not take less than 10 tablets. Do not take less than 10 tablets of 1,000 milligrams a day. And if you take a little more, there's no problem. And if after 3 weeks of taking it every day you don't notice a difference, forget about it. But it seems to help out with the bacteria. And some brilliant person will tell us all the other things that vitamin C does, along with ADP to ATP and so forth. So, also B complex. I tried B1, B12, helped pretty well, but just to save time and money, I tried B complex 100. It seemed to work much better on the patients. No one's had any problems with B6. I also tell the adults to take 10 of those a day. Folks that have taken much more than that haven't had no problems. In addition to lots of protein, which you use in third-degree bird patients, a third in a glass of low-fat milk twice a day. I tell everyone that's to catch you up, along with stretching muscles. So I went quickly, but because everyone's kind of going in so many directions, and the thing is to recover, and it's so simple, and there's so many problems, complications from going in so many directions. You have so many gastroscopies done for this, and yet leading to nowhere. You've had all these myocardial workups when it's pectoral pain. Quite a few of these waves have caused Bell palsies. So MRIs are ordered, colonoscopies for the constipation, the ultrasounds for the PIDs, and it's just a waste of time and money and effort. It's a waste of time, money, and effort without getting anywhere, and with patients resulting on antidepressants, analgesics, with no recovery. So, if anyone's out there with post-traumatic stress disorder, and because it's airborne infectious mono, and it's very contagious, I'm pretty sure the Gulf War syndrome, part of it, was due to this. So being bunked up, the soldiers will catch quite a few of these things. I've seen some of the soldiers come in, and they've had this problem. Very important, you look at the pharynx. The pharynx is usually scarred. It's a giveaway. It's scarred, and so many times it's very swollen and it's painless. But the scarring is very characteristic. I wish I knew how to work this device a little bit better so I could show you pictures of scarred pharynxes. Anyway, so I hope this has helped, and if anyone with post-traumatic stress disorder and Alzheimer's has the neck, back, and leg pain, has that neck, back, and leg pain, especially of the left side of the body, and they should try what I mentioned. Very important. If you start taking the vitamins without the antibiotic, you might feel woozy because it seems that you start to get rid of the bacteria, but very slowly. It's very, 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 very important to take the antibiotic to eliminate the bacteria quickly. Okay, that seems to be a big trick for this thing. Okay. Well, God bless, and thank God for the men and women that take care of us and that are in uniform. I hope everybody finds some benefit in this. Thank you.